In this video, we're going to talk about the most common, most favored, and definitely most popular brow lift, at least in my practice, which is known as the endoscopic brow lift. So we're going to be using an endoscope, aka a camera, to be elevating the brows. Again, probably the most common practice and definitely my favorite. So to talk about the brows a little bit more in this video before we hop into the endoscopic lift is the difference between male and females. So in a female, the brow starts here at the rim in the center of the brow, and then as we move out laterally, aka towards the ear this way, you're going to want to see a feminine arch to the brow. Think about Angelina Jolie, and it's going to arch and be above the rim as we move out from medial to lateral. In a male, that brow is going to just be at the rim throughout, uniformly throughout. So those are our aesthetic goals. So I bring that up before talking about endoscopic brow lift, because with an endoscopic brow lift, since we have the camera, we are visualizing everything during the procedure. Your incisions are in the hairline, they're hidden, and they're also the smallest incisions compared to the other two videos which we talked about. Because we just we were able to do it with an endoscope, one hand holding the camera, the other hand doing the surgery and doing the dissection. So that's really cool that your incisions are smaller here, and they're also hidden in the hairline. Also with this approach, when you have the endoscope and you're visualizing everything, you're paying attention to those nerves, you're paying attention to those muscles, those veins, those arteries. Also here, when we're doing the endoscopic lift, of the brows, we're getting rid of those forehead creases, we're lifting the brows, but more importantly, if you remember what we talked about at the beginning, is that not every patient's brows age the same. One side could be different than the other. And also sometimes people don't need a lift medially in the center. Maybe they just need a lift laterally towards the side where you want that arch. If someone doesn't need it medially and you overlift them, they're going to have this scared look all the time. So we kind of are able to see what the patient needs and deliver that lift depending on where they've aged the most. Is it the whole brow? Is it the middle brow? Or is it just the outside brow? And again, really small incisions because we're using the endoscope. Really awesome technique, definitely my favorite to use.